It's April in Kansas, just after sunset, and the residents of this town are unwinding after their busy day. Well, the National Weather Service has just issued a tornado warning for south central Kansas. Spotters report that this is a large, rapidly moving tornado, so anyone living in the path of this tornado should take shelter immediately, and that means if you need to get out. Then, they hear it. In an instant, it's all gone. They're in the dark, no power. Many are injured. Some are dead. All resources are gone. No EMS, no hospital, nothing. Now what? They need help fast. First aid, medical transport, evacuation, hospitalization, and shelter. And in the days, weeks, and months ahead, they'll need much more. Because what started as an immediate crisis for some will soon evolve into a matter of health and well-being for the entire community. And that's the story of ESF-8.
After a variety of large-scale disasters at the national level, the federal government decided that they needed to have a better way to coordinate responses among like partners.
And 9/11 was the catalyst because of the enormity of the situation and people coming from all across the nation. And having a formalized national incident management system really was driven home then.
And from that framework, 15 emergency support functions, or ESFs, were established.
ESF-8 is a grouping of all people that have to deal with the physical and mental health of people affected by a disaster.
The emergency support function for health and medical is so critical because you really don't have a disaster without threat to life.
So ESF-8 was developed to cover all of those aspects of agencies that respond to health and medical needs of patients or victims of a disaster.
So that we can have people, no matter where they're at, where they respond to, operating off the same sheet of music. And that's the important thing.
The South Central Kansas ESF-8 region encompasses the 19 counties which also make up the South Central Kansas Homeland Security region. Within this region, there are more than 200 partner agencies representing various specialized ESF-8 disciplines, including emergency medical services, hospitals, fatality management, nonprofit agencies and volunteers, mental health, animal response, public health, and environmental health. We'll be taking a closer look at the role of each of these partners in the video module chapters which follow.
ESF-8 really isn't a standalone organization. It's comprised of a variety of different agencies that are really there to make sure that during a disaster there is a coordinated, efficient response to ensure that the needs of the community in which has been affected have been taken care of.
There's no one in charge of it that's sending out orders. It's a concept, it's an idea to get these people with a common goal to collaborate and coordinate.
ESF-8 is simply a formalized, structured way to describe the mutual aid and collaboration which has been occurring among health and medical response partners for years.
Mutual aid is very simply neighbors helping neighbors. That goes back to the beginning of having a fire in a community or a medical emergency or whatever, and you didn't have enough people to handle it, so you called your neighboring community, and that's what it's all about.
ESF-8 encompasses this traditional idea of mutual aid and takes it to a new level of enhanced coordination and collaboration. The end result being that the relationships are in place, no matter what the incident, and everyone knows how to interact and work together to save lives.
The ability to bring all, whether it's a local health department, whether it's an EMS service, whether it's a hospital, to be able to pull those together and work together regardless of where they're from. That's the whole idea behind this, is we teach everybody how to work.
ESF-8 has created that for us. We know who these partners need to be so that as soon as something arises, we have those contacts, we can make these decisions, and we can move forward quickly and efficiently.
Another important component of the ESF-8 strategy is for all the partners to understand each other's role.
It's important for each individual within each ESF-8 agency or organization to understand the role of all of those other partners, so that when a disaster happens, they know what everyone else's responsibility is and how that affects the role that they would play.
Not only is it important for them to know that, but it's also important for them to know what resources they bring to the table and what limitations they have as an agency who's responding to a disaster.
The specific type of disaster which would involve ESF-8 partners will vary greatly from place to place. But one of the determining factors would be that local resources become overwhelmed.
For example, a large area might be able to take on and handle by themselves a bus crash of approximately 30 people, where in a smaller rural area that would overwhelm their resources. So it's not like it's a disaster is a disaster is a disaster. It really is a disaster in a jurisdiction at a specific given time is what might constitute the need for ESF-8 partners to come to the table.
Here in South Central Kansas, though, we have specific dangers which threaten all our communities.
The disasters that affect us the most and that are likely to trigger an ESF-8 activation would generally be weather-related. Tornadoes, flooding, ice storms, major wind events, things like that.
But not all threats in Kansas involve weather.
We have possibility of hazardous materials, hazardous chemicals incidents, health-related issues, a pandemic, for instance. And one of the things that probably we don't think about, but is up there because we're an agricultural state, is something that might affect our agricultural industry that could be transmitted to the humans.
Regardless the type of disaster, all regional incidents have two common elements: local resources being exhausted and a large number of people being physically or mentally affected.
There might be a lot of deaths due to the result of the disaster. There might be evacuations or long-term displacements based on the disaster itself. There could also be situations that would require the hospitals to surge to meet the demand placed on them. There could also be situations like a pandemic where public health is trying to prevent the spread of a contagious disease.
Well, of course, locally it would be the Greensburg disaster. And we took out a whole community, and every ESF-8 function that might have existed there before the tornado didn't exist afterwards, or was in a state of disrepair to where it couldn't be used.
The South Central Kansas ESF-8 region operates at the grassroots level to develop a formal and structured system of responding to disasters. There are two broad components.
One being the planning piece, that piece of coming together prior to disaster to build those relationships, actually understand what the limitations are of each response agency. And then the second piece of that is actually during a response. Again, coming together to make sure that we have a coordinated response to the disaster at hand, and that we're able to care for the health and medical needs of those people who have been affected by the incident.
It all begins with the planning process. Throughout the year, partners are brought together from across the region to share and discuss effective ways to cooperate, communicate, and integrate into the big picture.
ESF-8 planning on a regional level is important because you have such a large varying degree of jurisdictions. You have small towns of 3,000 people, and then you have a large metropolitan area of several 100,000. So you have public health departments, hospitals, emergency medical service, EMS, response agencies and organizations, mental health, environmental health, veterinary individuals. Then you also have coroners, funeral directors,
all of whom need to be on the same page when it comes to disaster management planning and response. An important part of the planning process is exercises which prepare the region for real-world disasters. In an exercise, partners from different agencies and disciplines must work together to respond to a staged disaster. This process helps identify areas of a plan that need to be improved, as well as help partners better understand their role in a disaster and the role of other partners.
In a disaster situation, ESF-8 partners would be brought in when local resources have been exhausted, when they can no longer handle that disaster on their own and they need to look for other assistance. They would reach out to regional partners.
As soon as the region has been alerted, the County Emergency Operations Center becomes the central hub. The emergency manager has the authority to request resources, declare a disaster, procure property, and much more.
We're kind of the orchestra conductors, if you will. In most cases, as emergency managers, our job is to know where things are and know how to get them, quite simply. For us, the incident management system and the emergency support functions are a godsend for us, because we know that no matter where we call, no matter what we need, we're going to have people that understand the system, and we're not going to be speaking Greek when we call for these resources.
The take-home message about ESF-8 really is that it's the same thing that we've done for years. It's just being done under a more unified and official structure.
What I would want people to understand about ESF-8 is that by having it in place and having those relationships built and having a collaboration already forming in the way that we're working together pre-incident, any incident that occurs, we can handle.
Like the Coast Guard, where any pilot, any crew member can crawl into any helicopter and they all work the same way. This is the idea behind the emergency support function for health and medical.
ESF-8 is focused on one essential goal, and that's caring for the physical and mental health of the public.
If you'd like to take a closer look at each ESF-8 agency, there are additional videos about emergency medical services, hospitals, fatality management, nonprofits, mental health, animal response, public health, and environmental health. These will help you discover more about their individual roles, what resources they bring to a disaster, and how they interact with other ESF-8 partners.